Hi, I'm Dr. Michael Gartner, board-certified plastic surgeon. I created this video here today to answer some of the most common questions about liposuction. So if you like these videos and the information given here, we're going to put a link on the top left here where you can link to our website and find out more information. We also have numerous YouTube videos on our YouTube channel where you can gain more information as well. So let's get right into it. So one of the most common questions I get: how do you determine if someone is a good candidate for liposuction? Yes, that's an excellent question. Well, first of all, you have to have fat. Believe it or not, there are some people who come in here who think they have fat and they have no fat, and there's really nothing to remove. Liposuction just takes away the skin. Liposuction just takes away the fat between the skin and the muscle. So it's in that subcutaneous plane where that fat is removed. Now on the love handle, that can be a large roll. On the abdomen, sometimes that just can be a small amount. On the bra roll, that can be a large amount. In other areas, it can be significant or it can be small. So it really depends on how much subcutaneous fat a person has. On the other hand, if they're too much overweight, there are higher risks. If they have a high BMI, there are higher risks for having complications to the procedure. And then sometimes it's better for a patient to lose weight first, and then we would remove any stubborn fat remaining from liposuction. But anybody with years of experience who's board certified by the American Board of Plastic Surgery, who does a lot of this, I've done thousands of these myself, can tell you right away and give someone realistic expectations of what to expect. Sometimes it's also important to someone who have years of experience to check out the quality of the person's skin. So if a person has terrible stretch marks, they have loose skin to begin with, well, they're not going to get tighter, they might get looser, and they might be unhappy being looser, where they might have been better off with an excisional procedure like a tummy tuck or something like that. So it's always best to come in for a consultation by a board-certified plastic surgeon to find out, all right? Okay, so question number 2 is, can I have liposuction at the same time as another cosmetic procedure? And how many areas of liposuction can I get at once? What other areas are acceptable for liposuction? Well, basically anywhere you have subcutaneous fat is acceptable for liposuction. Now, there are risks to liposuction. Whenever you remove fat, you replace it with swelling fluid. So there's a certain amount of fat you can take out of the body before you run into problems. So what happens is if you do large areas, and that fat, that fluid then goes into those spaces from the inside of the body, from the arteries and veins. So what happens is you can have large fluid shifts, and then you can have a small amount of fluid left in your arteries and veins. That might cause a problem with your heart, and that's why people sometimes, especially when they go to other countries, die of liposuction, especially other countries, because they're going to do liposuction from head to toe, and then they take risks on the amount. So usually the standard in general is 5 liters. So you don't want to take out more than 5 liters of material out of one person in one day. So usually for me, that's like 3 to 4 areas depending on the size of the person. Those are large areas too, usually abdomen, waist, back, and sometimes another area like the arms or in the thighs. So usually that's enough for one day. Also, we also put a drug called lidocaine in the body when we do liposuction. There's a certain amount of lidocaine you can put in the body before you overdose them and cause problems as well. So if you stay within the recommended guidelines, it's always better to come back, safer to come back and do more areas another day than do everything at once if you have a lot of work to do. Okay? So because of that, smaller areas can be done at the same time with other procedures. Once again, you can't do 5 liters of liposuction and multiple other things at the same time, because once again, those other areas are going to swell too. Once again, you're doing fluid shifts, and you're going to be dehydrated in the arteries and veins, which could tax your heart and cause problems there. So liposuction can be performed with other procedures at the same time, but once again, it depends on the other procedures, depends on how much swelling the surgeon would anticipate having, and it depends on the size and the areas of liposuction involved. So, but usually when you do other areas, you have to be a little bit more conservative than if you're doing liposuction alone. All right. So I hope this answers your questions. And once again, we'll put a link on the top left where we can give you more information. And once again, you can refer you to my YouTube channel, Dr. Michael Gartner, FACS. We have numerous YouTube videos on liposuction where you can gain more information. I hope you found this helpful.